What's up, guys? How's it going? Cade Moore with More Muscle, and today we're going to be talking about Reyes syndrome, guys. Reyes syndrome is an inflammation in the liver and in the brain. This is very rare, and they believe it has something to do with, after a viral chickenpox or a viral flu. So basically, if you have a viral flu or viral chickenpox, you're at increased risk for Reyes syndrome, although it is extremely rare. Next, there is a belief that, Reyes syndrome goes along with the use of aspirin. So, using aspirin or salicylate products, it's going to increase your risk for Reyes syndrome following a viral illness, guys. So, but this is very, very uncommon, very rare, but it's still important to know about this Reyes syndrome. Mainly happens in, children and teenagers. But yeah, this is inflammation. It affects the liver and brain, causing liver dysfunction and cerebral edema. And you'll see some physical assessments, and that's including lethargy, irritability, combativeness, confusion, delirium, profuse vomiting, seizures, loss of consciousness. And guys, any time when you have inflammation in the brain, you're at risk for like cerebral dysfunction, guys. So it's really important. I mean, you can lose some, intelligence when you have a lot of swelling in that brain. And what you'll do is you're going to get a liver biopsy, and you're going to get blood ammonia levels, and that is kind of to do with the liver. You're going to do your blood electrolytes, and you're going to test coagulation. That's like clotting factor, to make sure they don't have like a bleeding issue. And to make sure that, the client maintains NPO status. Guys, NPO status is basically they shouldn't be eating or drinking anything, and that's going to help them. And you want to make sure after the procedure that they don't have a possibility of hemorrhage. Hemorrhage is excessive bleeding, and you want to assess vital signs, monitor blood pressure and heart rate, because that can tell you if you are having hemorrhage. For example, if there's an extremely high heart rate and a very low blood pressure, guys, this is an indication of hemorrhage. Sometimes you'll see some bleeding in the stomach, and you'll see these vital signs, and that could be an indication of that. And they're very quick onset. You might see a pale face. Those are signs of hemorrhage. And hemorrhage is, excessive bleeding. I think anything over like a can of soda of blood or something like that is, very dangerous. So blood's very important. Your body can rebuild it quickly, but you don't want to lose too much of it. And then also you're going to do a lumbar puncture. So you'll have the child or teenager, they'll sit in a lateral position on their side, and they'll use some lidocaine or some type of, analgesic, basically a painkiller. And, you put it on the back, and they'll take that lumbar puncture, and they'll test that cerebral spinal fluid to see if you have, Reyes syndrome or meningitis or whatever it is. And then you want to make sure you maintain IV fluids as prescribed. Maintain eyes and nose intake and output. Avoid, flexion, extension, or rotation. Keep the head in the midline position. And obviously you want to monitor coagulation, prevent hemorrhage, monitor, pain status and how they're doing mentally, psychologically. And then for increased intracranial pressure, that's a big, common thing you'll see in Reyes syndrome, which can cause significant harm. Well, we want to administer mannitol, guys. Mannitol is basically decreases cerebral swelling, and that can, save a patient. That can help them think better. You have the ICP, you want it to be around 5 to 15. And if it gets above that 15, that can be dangerous for that patient. So ICP, guys, intracranial pressure. You want it to be between 5 and 15, I believe. Anything higher can be, harmful. After you want the client to do physical therapy, and obviously, guys, these patients should not be using salicylates or aspirin. So guys, Reyes syndrome equals no salicylates or aspirin. because that has an increased risk for causing Reyes syndrome. So if you have like a pain, you want to use Tylenol or something else, but no aspirin, because that increases the risk of Reyes syndrome. You want to make sure they don't have a hearing impairment or a speech impairment, and you want to explain it to the families, loved ones, and you want to support the family in grief, and even make spiritual support as appropriate. So if they have a bishop or something that they need a blessing, then you can help them get that scheduled. So anyways, guys, that's Reyes syndrome, guys. Remember, Reyes syndrome is kidney inflammation in the head. It's caused by a viral chickenpox or a viral flu or influenza, and you usually see a big increase when you see salicylates or aspirin. You're gonna see this increased risk of Reyes syndrome. So you want to avoid any salicylates, and you want to take Tylenol instead. So thanks, guys, for watching. Subscribe.